Hey there, my name is Dr. Brad Deacon. We're going to talk today about bone density and also a little bit about osteoporosis and osteopenia, just to clarify what they are, because we want you to have great skeletal and joint health, because that in part affects your nervous system. So we're going to give you a list of things to avoid, but also kind of clarify some misconceptions. Now, the first thing about it is that we are always told, if you go to a person that wears a white coat, a healthcare provider that wears a white coat, they'll tell you to make sure you have a lot of calcium, magnesium, and vitamin D. While those three things play a role in bone health, they are not the determining factor. In fact, taking those supplements more than what you should can actually cause a lot of health issues. I don't know if you knew this or not, but calcium ions actually can play around with your heartbeat. So we want to make sure that you don't take those things in excess. And funny enough, usually, like if you take a look at the North American diet, usually we urinate out more vitamins and minerals than most other cultures get in their diet. So taking more of those supplements is not the most advantageous thing for you. In fact, now we're starting to find out from biochemists that you can actually take significantly too much calcium, even if you're taking supplements, and you'll actually start to develop osteoarthritis as a result. So don't play chemist. Just get your food and get your nutrients from natural food products, not things from a package or not things from a vitamin bottle. Always try to go to natural food first. So that's the first thing to help bone density. Now, the second thing we want to get across is bone density is not nutritionally based for most people. It actually has to do with weight bearing. You know, if astronauts go into space, they lose 6% bone density per month. And again, this is not something that some chiropractors just dreaming up. This is information right from NASA. So astronauts go into space and they're not fighting gravity anymore. So their bones become more porous and less dense. So if you think about that, weight bearing from gravity increases bone density. So how do you accelerate gravity? You actually do weight training exercises, weight-bearing exercises to increase bone density. And we're not overly worried about bone density. We're only worried about it when it gets to a pathological state where you can become osteoporotic and have a hip fracture or have a compression fracture. That doesn't really happen too often. So increase your weight-bearing exercises. Now, the next thing we want to make sure is you limit smoking, and we limit alcohol. Both of those things decrease bone density, so we don't want to do those, right? Alcohol is kind of the fun one, but not in excess, of course. Now, we also want to make sure that you avoid soda, as you Americans call it, but we want to avoid pop, as we Canadians call it. It's got carbonated water in it, and carbonated water, carbon dioxide and water make carbonic acid, and that decreases bone density. So if people stopped drinking pop or soda, their bone density would actually be much more preserved. Now, the last thing that we want to get across is medication. By regulation, I'm not permitted to tell anyone to get off their medication, but I want to caution you about it. A lot of medications, things like puffers and inhalers, are actually steroids. Steroids decrease bone density. There's a lot of other medications that can decrease bone density as well, but the number one cause, or one of the most important ones to avoid or be cautious about, are cortisone injections. Usually people get cortisone injections because they have pain in certain joints, but cortisone injections have been proven to decrease bone density, specifically in the area of injection. So you've got to be super careful about that. And again, your skeletal structure has a massive impact on your nervous system, which is the master control system. We want to make sure here at Life Lounge Chiropractic and Health Center that you have the best functioning nervous system as possible and the most fully functional skeletal system. We can help you. If you want to have great body and great health, please come and investigate our office. My name is Dr. Brad Deacon. Again, I'm coming to you from Life Lounge Chiropractic and Health Center in Burlington, Ontario. Thank you.